Right on time. Namaskaram to all and good afternoon. As a resident of Ananya world, because we should call this a world and not just Ananya, we are also being listened to, Dr. Saab, we are being listened to by 4, 5 and 6 phases. So there is a live transmission going on from here, and I see some friends from 7 who are sitting here with us, but especially from phase 3 that many of us are here, let me welcome all the people who are attending today's lecture, which is really we are all looking forward to. The subject, which is very relevant to all of us, is healthy aging. Ananya says happy aging. So we have a little bit of healthy and happy together, and staying infection free is your title. Let me at the same breath welcome our speaker of today, Dr. V. Ramasubramanian, who is both a special and an esteemed guest. The word special is because Dr. Ramasubramanian has been invited by none other than, and needs no introduction, by our own doctor, Dr. N. Balakrishnan. The use of the word esteemed. The use of the word esteemed is because our speaker for today is widely regarded as one of the premier infectious disease specialists. Let me briefly, I cannot elaborate on him, which will be available on Google, but with decades of clinical experience, Dr. Ramasubramanian frequently leads educational forums and contributes to medical research in tropical medicine across India. He is currently practicing as a senior consultant at Apollo, which all of us know, and of course the SIMS Hospital in Vadavalli. So there is Apollo. He is highly decorated, but I'm not going to go through that because the Google and the Practo will tell you all about him. You will have pages and pages, but I would like to underscore that patience consistently praise his diagnostic precision, deep expertise in tropical fevers, and of course, empathetic approach to managing complex bacterial, viral, and fungal infections. While saying this, what actually got me going is that the patients highlight his ability to quickly identify rare conditions and his rational, patient-friendly approach, which is most important for doctors, an approach to antibiotic and stewardship. With this, may I request Dr. Balakrishnan to felicitate our guest speaker before we hand over the floor to him. Before I give him the opportunity to give him the floor and the opportunity of the mic, I need to tell that he has accepted to seek questions from the audience, and he will be happy to answer that. So he does want everyone to engage in this discussion. Over to you, sir.
Good evening, everybody, and thank you very much for those kind words. I feel really honored to be here in front of you. And I wish my father was here. He's in Chennai. Today is his 95th birthday. And, he's a practicing physician and he still goes to work every day. So I wish, anyway, my aunt is here, so thank you very much for the opportunity. Would you like me to speak in English or in Tamil or in Tinglish or English? Okay, fine. English, okay, fine. So நான் அப்பப்ப தமிழ்லையும் பேசுறேன், இங்கிலீஷ்லயும் பேசுறேன். PowerPoint slides இருக்கா போட்டுருக்கீங்க? The screen has to come down. While they are getting it, let me start talking. Okay. Now, becoming old is inevitable. All of us become old sometime, and understanding the challenges of what happens to our body and our mind as we grow older probably is what will make us age happy, as you had said, healthy, happy, whatever. And in today's talk, over the next about half an hour or so, I shall be touching upon various aspects. It won't be strictly infection. Falls, கீழே விழுறதுனால என்ன ப்ராப்ளம் வரும், the occurrence of infections, எந்த infections common, specific emphasis on diabetes and diabetes infections of the leg, the importance of preventing infections, கை கழுவுறதுல இருந்து respiratory etiquette mo, எப்படி இருமறது, எப்படி தும்மறது, all that is very important, not only for us to stay protected, but also to protect our people living with us, and also stress on vaccines. Okay, so I'll just recollect what slides will be coming there and stuff. The first is to do with falls. வயசாகும்போது எல்லாருக்குமே மசில்ஸ் வீக் ஆக ஆரம்பிச்சிடும். ஸோ மசில்ஸ் வீக் ஆரம்பிக்கும் போது கோஆர்டினேஷன் ப்ராப்ளம் வரும். ஸோ வாட் ஹேப்பன்ஸ் இஸ் minor problems will cause us to trip and fall. Okay, so what do you do to prevent falls? This you have to practice. So first you have to and learn to slow down. Second thing is diabetes. It has been shown that almost 30% of people above the age of 65 are diabetics in India. So 1 in 3, even in this hall, at least 30 to 40% will be diabetics. Okay, this is inevitable. And diabetes increases the risk of infections. Infections increase because of high can get foot infection. 60% is a big number. 6 of 10 can get infections. If you get an infection in the leg, what is called as diabetic foot infection, diabetic foot ulcer, almost 1/3 will end up in an amputation. Now, amputation na inge kadayadhu. It could be just a toe amputation, it could be foot amputation. In other words, 1 in 3 can have an amputation. If you have had an amputation because of a diabetic foot infection once, in 5 years' time, you can, in 3 years' time, 2 out of 3 will have a subsequent amputation. So, ஒரு தடவை infection வந்து ஒரு தடவை காலையோ விரலையோ எடுத்துட்டாங்கன்னா next 3 வருஷத்துக்குள்ள திருப்பியும் இந்த மாதிரி நடக்கிறதுக்கு வாய்ப்பு இருக்கு. And what is more startling is, in 5 years' time, anybody who has had an amputation, 1 in 2 will die. This is all statistics, medical evidence which is available. So, யாருக்கு ஒருத்தருக்கு amputation காலில் diabetic foot infection காக பண்ணியாச்சோ next 5 வருஷத்துல 2ல ஒருத்தர் இறந்துருவாங்க. So, which means you have to protect your feet, which means you have to prevent infection. So, அதுக்கு first வந்து அதான் நான் பார்த்தீங்க வந்து எல்லாத்தையும் சப்பல் எடுங்கோ சொல்லிட்டு இருக்கா. If you are inside, that is okay, because inside flooring is fine, but never walk barefoot. I see so many people who are diabetics whose sensation is damaged. நரம்பு டேமேஜ் ஆனதுனால கால்ல they don't have normal sensation. Heat, cold or பட்டா கூட தெரியாது. So they ignore it. These people, when you are walking barefoot in temples especially, இந்த மாதிரி வெயில்ல கோயில சுத்தும் போது கால் heat will damage the legs, they will get an ulcer that will get infected. Please, I will say to socks போட்டு போங்க, ஏதாவது போட்டு போங்க. Don't go barefoot outside. Ideally, you should wear covered shoes and you should examine the slides. So these are the points I wanted to highlight today. So you can see falls, infections and other problems, diabetic foot infection, oral health, hand hygiene and stress management, importance of protein, strength and exercise, vaccination, and staying healthy while traveling. Because all of you will be traveling. You are all reasonably fit people who will be traveling. Can I have the next slide, please? Okay, this is what I've said. As you grow older, the light anachur mudiyuma. your immune system starts weakening, what is called as immunosenescence. In the Mari your risk of infection is higher, which means everybody above the age of 50 should get certain vaccinations. Muscle loss. Your muscles start wasting away, and especially vegetarians, this is a huge problem. This place is purely vegetarian, which means you have to take extra protein to build the muscles. சும்மா தயிர் சாதமும் இன்னைக்கு இஞ்சி இஞ்சி சம்திங் புளி இஞ்சி தயிர் சாதமும் போறாது. You need some protein that it may be tasty but it doesn't help your body. Reduced gut health. I was very impressed to learn that Dr. Balakrishnan and his wife are telling me that after coming here they have not even seen one diarrhea related to food poisoning which happened in this place. Excellent. So you're all lucky to have services like that, but then your gut becomes weak. 4. Slower healing. Enga infection vandalum at the time of cellulitis, it's an infection which you get in the skin and the subcutaneous tissue. The cellulitis vandana the ஆறதுக்கு especially in diabetics 2 to 4 வாரம் குறஞ்சதாகும். Even for any age this is a problem, especially with the elderly. Dry mouth and skin. All of us ignore oral health. We are scared to go to the dentist. Anga pona avanga the drill eduthu poinu pannuvan, So, but you have to have preventing a dentist. Excellent. So you please at least every 6 months visit the dentist to have your teeth checked. And lastly, you will all be taking several medicines as we grow older. One side diabetes, one side blood sugar, one side prostate problem, one side sometimes glaucoma. These medicines can interact with each other. My aunt was telling me she's having swelling in the legs. Otherwise, she's not a thyroid patient, her sugars are all right, everything was fine. I went through her list and found there were 2 or 3 medicines which can themselves cause pedal edema or swelling of the legs. So, nariya marundu eduthumbodhu the interaction and the side effects, please keep in mind. Next please. Okay, so the falls pathi na erkanave solliten. So, prevention is daily strength and balance exercises. Remove trip hazards at home. In fact, இன்னைக்கு நான் சுத்தி பார்க்கும்போது ஒரு இடத்துல டாக்டர் பாலகிருஷ்ணன் பார்த்து சொன்னார், one of the carpets was slightly curved. Very dangerous. That's a commonest cause. பட்டு தடிக்கு விழுவோம். Annual vision and hearing checks and review medicines with your doctor. Next slide, please. Common infections after 65. Pneumonia, it's called the captain of death. Most people as they grow older, the cause of death is usually a pneumonia because it's finally you end up, pneumonia is an infection in the lung, bacteria nala varala, but you can get viral pneumonia because of flu or COVID. These are viruses which typically affect the upper respiratory tract, but sometimes lung la baadhipu erpadradanaala it can cause a pneumonia and can be very serious. Please remember, flu is just not a cough and a cold. Flu in people under the age of 5 years, above the age of 60-65 years can be very, very dangerous. You can end up with a severe viral pneumonia, hospitalization, ventilator, and death. I don't want to scare you, but this can be prevented by a flu vaccine every year. Okay? Herpes zoster or shingles, akkinu solva Tamilla, chinna vayasula yarukella chickenpox vandirukko, this chickenpox virus stays in the nerve root. And beyond the age of 50, when your immunity starts going down, it can reactivate and cause shingles or acne. This rash, this can be excruciating pain, post-herpetic neuralgia. Are there any people who have got herpes before? So ask people who have got it. It can be very, very traumatic, and that pain can sometimes last several months. It is preventable by a vaccine. Everybody above the age of 50 is strongly recommended. It's an expensive vaccine, but if you can afford it, take it. Urinary tract infections. You don't pick up urinary tract infections from toilets. Let me tell you, a lot of people think that நாங்க வெளியில நாங்க போகும்போது தண்ணி குடிக்க மாட்டேன், ஏன்னா தண்ணி குடிச்சாங்க எனக்கு பாத்ரூம் வந்துடும், அங்க பாத்ரூம் அசிங்கமா இருக்கும், எனக்கு அங்கிருந்து யூரினரி இன்ஃபெக்ஷன் வந்துடும். Remember, if you hold your urine for a long time, if there is stagnation of urine in your bladder, that can lead to infection because bacteria come from the outside. It is your own bacteria. Nammaloda back passage la irundhu bacteria can come up and enter the urinary tract. In men, it doesn't happen. It is very, very uncommon. But in women, urinary infections are very common, and post-menopausal diabetic women can get recurrent urinary infections. Again, you ask somebody who has suffered it, they will tell you it's not, it can be life-threatening. Sometimes urinary infections, kidney varaikkum poitu pyelonephritis solluvom, and it can cause septicemia or sepsis. But this is also a problem in elderly, post-menopausal, diabetic, especially women. We can discuss this in questions, urinary, but we can discuss. Skin infections, as you grow older, skin becomes dry. It will cause itching, you scratch. Now, if you have got nails and you scratch, you may cause small tears in the skin. But ராத்திரி தூங்கும்போது கால் அடிச்சா என்ன பண்ணுவோம்? எழுந்து சுரிஞ்சிருந்தா இருக்கும் மாட்டோம். என்ன பண்ணுவோம்? இந்த கால் அடிச்சு இந்த கால் நல்லா பண்ணுவோம். And lot of people, especially those who are barefoot, கால் வந்து பித்த வெடிப்பு இருக்கும். Your heel is very, very rough. And when you do that, இந்த கால்ல இருக்கிற ஸ்கின்ல சின்ன சின்ன கிழிப்பு வந்து அது வழியா பாக்டீரியா உள்ள போய், that is how cellulitis happens. Cellulitis, I told you, is an infection of the skin and the underlying tissue. So please, night தூங்குறதுக்கு முன்னாடி all of you use moisturizing cream. அதே மாதிரி கார்த்தால ரஃபா இருக்கிறவங்க கார்த்தால குளிச்சதுக்கு அப்புறமா மாய்ஸ்சரைசிங் cream, a simple intervention will at least இந்த மாதிரி ஹார்டா இருக்கிற ஸ்கின் கிழிப்பு ஏற்படாம இருக்கிறதுக்கு ஹெல்ப் பண்ணும். And gastrointestinal infections, that please eat hygienic food. That's the only thing. இத நான் சொல்லிட்டேன். Diabetics are at an increased risk of infection. Next slide. Foot infection, again, நிறைய பேர் என்கிட்ட சொல்லுவாங்க, சுகர் எப்போ செக் பண்ண? நான் செக் பண்ணி 2 வருஷம் ஆச்சு சார், எப்படி கண்ட்ரோல் இருக்கா? கண்ட்ரோல் இருக்கு சார், போன வாரம் கூட எனக்கு ஒரு புண்ணு வந்தது, 2 நாள்ல ஆறி போயிடுது. நோ, if it is delayed healing, it can occur in diabetics, but just because புண்ணு வந்து சீக்கிரம் ஆறதுனால it doesn't mean your sugar is under control. Please check your sugar, ideally at least every 3 months, practically at least every 6 months. Please check your fasting and your postprandial and your HbA1c. This is something you can control. So do not neglect your diabetes. 20 years kaichi it will come to haunt you. So please take care of your health. Any open wound that doesn't heal, any pus, foul smell, black discoloration, jwaram with a foot sore or redness, kala veekom, vali, warmth and 7th போறது is an indication of infection. In fact, I will tell all couples who are there, look at each, because as you grow older, கண்ணு சரியா தெரியாது, நம்ம காலை நம்ம தொடறதே கஷ்டமா இருக்கும். So if you are living together, one of you check the other person's feet every day. After your bath, make sure that you wipe the area between the toes. அங்க ஈரமா இருக்கிறதுனால you get சேத்து புண்ணு வழியா தான் பாக்டீரியா sometimes enter பண்ணி இன்ஃபெக்ஷன் வரும். So இதெல்லாம் simple cleanliness which can keep you healthy. Next slide. Oral health. I told you, we neglect our mouth. Gum, it has been shown that one of the major risk factors for heart attacks is poor gum health, periodontitis and so on. So நம்ம வயசாகும்போது the gums will start receding. Your teeth ஓட roots better தெரிய ஆரம்பிக்கும். What நல்ல பல்லு இருந்தது, பல்லெல்லாம் இவ்வளவு பெருசாகும், அடியில the root comes down. This happens for everybody. Your dental, gingival health, gums ஓட health will worsen with time. Please get it checked. Smell வரும் சில பேர் வாய் கிட்ட போனா, that is because of bacteria in the gum causing infection. இது இருக்கிறவாளுக்கு the risk of heart attacks is much higher. So please clean your mouth, ensure 2 வேளை நல்லா பல்ல தேய்க்கணும் and check with your dentist periodically. Missing teeth, வயசாகும் போது பல்லு வலிக்கும், ஒரு பல்லு விழுந்துரும், சாப்பாடு சரியா கடிக்க முடியாது, or nutrition will come down. All this also contributes to infection, malnutrition. And lastly, dry mouth இருக்கிறவாளுக்கு ஃபங்கஸ் இன்ஃபெக்ஷன் வர வாய்ப்பு ஜாஸ்தி. ஃபங்கஸ் இன்ஃபெக்ஷன் வாயில வந்ததுன்னா டேஸ்ட் போயிடும், எதை எடுத்தாலும் மண்ணு சாப்பிடுற மாதிரி இருக்கும்பா, அண்ட் கசக்கும் வாயில எது போட்டாலும். ஸோ அந்த மாதிரி இருந்தா, or if you take a course of antibiotics for some infection, antibiotics will get rid of the bacteria, fungus will come in, and fungus can cause altered taste. So one dose of antifungal tablet sometimes will get your taste back. So this, and especially dry mouth, can cause fungal infections. Remember. Next slide, please. Okay. Now, most of you are, above the age of 60 here. But I remember my grandmother, when I was young, all she used to say was, வெளியில போய் விளையாடிட்டு வீட்டுக்கு வந்ததுக்கு அப்புறம் கையும் காலையும் அலம்பிடாம உள்ள வராது. In fact, we had a tap outside the house. We used to wash our hair. அதே மாதிரி பாத்ரூம் போனேன்னா வாஷ் பண்ணாம வராது. bathroom வெளியிலேயே ஒரு வாஷ் பேசின் இருக்கும் அலம்பு. சாப்பிடுறதுக்கு முந்தி make sure you wash your hands. This was ingrained and verum wash இல்ல. We used to wash with soap and water. It has been shown that the simplest way to stay healthy is clean hands. Washing your hands with soap and water for 15 seconds, at least 6 to 8 times a day, can decrease chances of infection by almost 50%. Okay? How do you get infection? It could be viral infections. For example, flu இருக்கும்போது டைரக்டா ஒருத்தர் கிட்ட இருந்து இன்னொருத்தர் மூஞ்சில தும்மி இருமி அப்படி வராம நம்ம கோவிட் போது பார்த்தோம். Flu இருக்கிறவா இருமினாலோ தும்மினாலோ அந்த particles containing the virus will come and fall here. So நான் புட்டனா இந்த இடத்துல வந்து விழும். If somebody touches this on the way down, takes their hand, இங்கே பாருங்க எவ்வளவு பேர் மூஞ்சி கிட்ட கை வச்சு உட்கார்ந்திருக்கீங்க. So this is how you inhale it. Okay, so it's the hand which is responsible for viruses being transmitted from door handles, from telephones to tables, chairs to your nose and mouth, and that is how you get it. So keeping your hands clean by washing frequently will reduce infections. Gastrointestinal infections. வெளியில போய் நம்ம இங்க பண்ண மாட்டேன், பட் அங்கெல்லாம் ஜாலியா போயிட்டு ரோட் சைடு கையேந்தி பவன் போம். அங்க சாப்பிட்டனா again it is because of poor hygiene on his part. யார் பண்றாளோ அவளோட problem. So please remember, if at all you do one thing, keep your hands clean by washing with soap and water. அப்படி வாட்டர் கிடைக்கலன்னா இப்பதான் ஆல்கஹால் ஜெல் கிடைக்கிறது, எல்லாரும் பேக்கில் வச்சுட்டு இருப்பா. அப்போ பீரியாடிக்கா அதை எடுத்து போட்டா that's the simplest way to keep your hands clean. Next slide. Two things which again have impact on infections. One is stress, two is sleep. இப்ப நிறைய பார்க்கிறோம், 40 வயசு, he is a CEO of a company, bright star, upcoming, goes to the gym and falls down dead. You read this very often. Young people, why do they get heart attacks? Heart attacks occur because of a block in the blood vessel which supplies the heart muscle. Heart pump பண்ணுது, okay? But அந்த muscle pump பண்றது, அந்த muscle-க்கு it needs blood supply. So there are blood vessels which supply the heart muscle. இந்த blood vessel block இருந்தாதான் we refer to as a heart attack, because a part of the heart muscle dies. That's a heart attack. Okay? So in the blood vessels which supply the heart muscles become narrow, become blocked, and one reason for that is some sort of an inflammation or reaction which can cause the block. Okay? It has been shown that both mental and infective causes can lead to this. ஒரு உதாரணத்துக்கு, it is not just cholesterol and platelets clot, அது மாத்திரம் இல்ல. Flu infection. If you get a flu infection creates a lot of inflammation in the body. And flu வந்து ஒரு வாரம் 10 நாள்ல the risk of heart attack is very high. So if in fact we did a study in our hospital, யாரெல்லாம் heart attack ஓட வந்தாலோ, we asked questions to find out how many of them had a fever with cough in the previous 2 weeks. Almost 15 to 20% had, which means ஒரு flu attack வந்து 1-2 வாரத்துல heart attack வர risk, stroke வர risk is very, very high. And if you take the flu shot, you prevent not only the flu, you prevent in the complications. Okay? Adhe mari pneumonia, shingles, all of them increase the risk of both heart attacks and strokes. And vaccination, preventing the infection, keeps you healthy by not getting the heart attacks or stroke. So managing stress, daily prayer or meditation, socially connected. The more socially connected you are, the happier you are, the less the inflammation. Limit news consumption. Cell phone after 8 o'clock, please leave it aside. I see so many people who say that they can't sleep and they are scrolling till 1 a.m. in the morning. Phone should be not in your bedroom after 8 or 9. Pursue a hobby, pet companionship. These are simple things which will help keep stress down. And quality sleep, regular sleep and wake times. Have a disciplined system for sleep. Avoid screens after 9 p.m. Keep the bedroom cool and dark. Avoid heavy meals at night and limit afternoon naps. You can have a short nap of 20 to 30 minutes, but if you sleep for 1 to 2 hours in the afternoon, night kandipa thooka varadu. So please remember, reducing stress is the most important factor in reducing infections, because stress and infections are directly related. Next. I told you, vegetarians, protein. As you grow older, your muscles they waste away, you become weak. How many of you can stand up without touching the chair handles? That's an important sign of your strength. If you need that means your muscles are not good. You have to learn to build muscles. Simple things, squatting. You start. You need to slowly build up your strength. Okay? So, protein is very important. I have written a few things. Dal, paneer, milk and buttermilk, groundnuts, rajma chana, curd, yogurt, soya, and eggs if you take. These are simple things which will increase the protein. The ideal requirement is at least 1 gram per kilogram. So if you are 75 kilograms, at least 75 grams of protein should be in your diet. Okay? Dietitian sir. Something to think about. Because I feel these are simple things which actually will keep you healthy. I repeat, Karatipal, all that is fine, but it doesn't add to the muscle strength or keep you healthy. Next slide. Strength building. Walking. I think most of you will walk. But walking alone is not enough. Next, you will say yoga. Yoga alone is not enough because walking and yoga are aerobic exercises. So flexibility, your endurance is fine, but that doesn't build muscle strength. And as you grow older, as I said, to prevent falls, you need muscle strength. So muscle strength will only come either by some strength training, either by weights, could be 2 kilos, 1 kilo. I'm not talking bodybuilders. 1 kilo, 2 kilo, or stress in the bands, resistance bands. You need to do some sort of exercise. Gym trainer, excellent. So you have it all. Very easy for you. Excellent. So that is what you need other than just walking. Next slide. Lastly, about vaccines. I know you've heard a lot about vaccines, but somehow we don't realize the importance. Vaccines na biomark, adanala side effect varuma. And I'm not talking about public. Public understand. Doctors ask me every day, in the version of flu potukanuma, flu vaccine edutunda enak edavadhu complications varuma. Vaccines are one of the safest interventions in medical practice. We give vaccines for children. Would we do anything without testing? So why are adults hesitant in taking vaccines? Your immune system starts waning. People above 50 years need 4 main vaccines. Flu vaccine every year, a pneumonia vaccine. Now PCV20 ஒரே ஒரு vaccine வந்திருக்கு. அந்த ஒரு vaccine போட்டா போறோம். மூணாவது shingles. அட்டிக்கு நான் சொன்னேன் இல்லையா? 2 doses 2 months apart. And நாலாவது 1 booster dose of tetanus, diphtheria, pertussis. Tdap ன்னு சொல்லுவோம். In fact, if you have children in the US who are they are having children, so you are becoming grandfather or grandmother, அங்க வரதுக்கு முந்தி அவ உடனே சொல்லுவா, இங்க டாக்டர் சொல்லிருக்காருமா, வரதுக்கு முந்தி நீ tetanus booster அங்க போட்டுட்டு வா அப்படிம்பா. So now they have realized, they tell the children to tell their parents to get vaccinated. So these 4 vaccines, please remember, are very important as part of your preventive health. Next. 2 words on pneumonia. I told you pneumonia is called the captain of death. It is caused by bacteria, viruses, several things. TB is also pneumonia. TB coming in the lung is a tuberculous pneumonia. So this is usually spread by coughing. Though viruses spread very easily, bacteria can also spread from one person to another. Lungs la poi உட்கார்ந்துக்கிறதுனால லங்ஸ்ல இன்ஃபெக்ஷன் வரும். ஸோ ஜுரம் வரும், இருமல் வரும், கொஞ்சம் சில சமயம் நெஞ்சு வலி வரலாம், சளி வரும், சம்டைம்ஸ் ரத்தம் வரலாம், மூச்சு விடுறதுக்கு கஷ்டமாகும். இதெல்லாம் the process of a pneumonia, and then it can cause a lot of breathlessness, hospitalization தேவைப்படலாம். Next slide. So pneumococcus அப்படின ஒரு bacteria is the commonest cause of bacterial pneumonia. And in the pneumococcus 100 பேர் pneumonia எடுத்தோம்னா கிட்டத்தட்ட ஒரு 50 பேர் the pneumonia is because of this pneumococcus bacteria. So இந்த pneumococcus bacteria க்கு prevent பண்றதுக்கு தான் இந்த pneumococcal vaccine சொன்னேன் இல்லையா? Typically குழந்தைகள் under the age of 5. So இப்போ routine எல்லா குழந்தைகளுக்கும் pneumococcal vaccine is given, just like tetanus vaccine, polio drops, and மாதிரி கொடுக்குற மாதிரி hepatitis B, pneumonia vaccine is given. But adults, we still not have routinely give. We don't give it. Above the age of 50, definitely above the age of 65, strongly advised to prevent pneumonia. Next slide. So these are the conditions which increase the risk of pneumonia. Smokers, people who have chronic lung disease, kidney disease, asthmatics, heart disease, diabetes, iva ellarkum the risk of pneumonia is higher, and these people should they are recommended to strongly take the pneumonia or the pneumococcal vaccine. Just one dose PCV20. Next slide. This just illustrates the higher risk of pneumonia. People with heart disease, lung disease, in people who are above 65, the risk is 6 times higher. People above the 65 who are 10 times higher risk of hospitalization. Next slide. And if you are a diabetic, the risk again increases. So in the multiple risk factors irundadana, the risk of getting pneumonia is much higher. So if you are above 65, if you are a diabetic, if you have heart disease, if you have lung disease, your risk straight away goes to about 40 times. And this is preventable. Next slide. Next slide. So 3 things to help avoid pneumonia: hand hygiene and hand washing, cough etiquette. Now, COVID time we were stressing on this. If you are coughing or sneezing, do like this. Because when you do this, you get virus or the bacteria on your hand, and then you touch something. So if you're doing this, wash your hands immediately. Otherwise, into your elbow, you're supposed to cough or sneeze so that you don't spread it around. Next slide. Last 2-3 slides. 1, vitamin D. Almost, I've seen 80% of people have low vitamin D, even though there is so much of sun. We don't walk out in the sun. So vitamin D, sun la irundhu namakku nariya kadaikum, but you need to spend at least half an hour in reasonable kaathala 7:30 mani sun la la ungalku vitamin D varadu. So it is not a practical way to get it. So please check it. One of the consequences of low vitamin D வந்து முதுகு வலி வரலாம், உடம்பு வலி வரலாம், tiredness இருக்கும். In fact, my vitamin D about 10 years ago was only 3. It was one of the lowest I have seen. Because I just get into the car, go to work and come back. So sun exposure kadayadu. So please check that vitamin D. General well-being, this is another thing which is important. Next slide. Lastly, couple of slides on traveling. Travel pandradhukku, these are all the risks of travel. People who are traveling by long flights, especially elderly, 65 male irukumbodhu, when you are sitting in the flight for a long time, the blood flow is sluggish in the veins. So the blood flow seriyillana, it can clot and cause what is known as DVT, deep venous thrombosis. So clots in the leg. In the leg clot வந்து கால்ல இருந்தா ஒண்ணும் பெருசா ஆகாது, கால் கொஞ்சம் வீங்குமே ஒண்ணும் ஆகாது. But if this clot moves up and comes and blocks your lung, it can lead to death. It's a pulmonary embolism னு சொல்லுவோம். It's a very serious complication. That's why we say long haul flights, 8 hours, 10 hours flight la போகும்போது every 2 hours get down, walk for about 1 minute or 2 minutes up and down, so that the circulation is better in the feet. I will skip all this. Next slide. And if you are traveling, before your travel, it is very important to meet your doctor, get all your medicines sorted out, take a prescription for that. These are several vaccines. If you do a lot of holidays, Southeast Asia poromo, typhoid, hepatitis A, hepatitis B, idella potukkom. So please check with your Africa poradhukku yellow fever. If you're going to Hajj, I don't think anybody here goes to Hajj, but if you're going to Hajj, pneumococcal vaccine, meningococcal vaccine is mandatory. So please check, take your vaccines, not one day before you go. It should be taken at least 1 month before you leave, so that it takes 2 weeks for the body to produce antibodies after the vaccine is taken. So please take care of that. Yeah, this is just the checklist. So medical check, vaccinations, what to pack, your regular medicines, a first aid kit, blood pressure monitor and glucometer if you are diabetic or hypertensive, and prescription copy in English. Drink only boiled water. In fact, we say if you're traveling, if you can't cook it, if you can't boil it, if you can't peel it, forget it. So take only stuff which is cooked, boiled, or if it's a fruit, you're able to peel it. If you can't do this, don't take that. It's a simple word. Cook it, boil it, peel it, or forget it. Yeah, okay, last slide. So your health is in your hands. 10 things to remember. Wash hands before every meal and after every toilet use. I'm sorry, this is something so, elementary, but this is a very big thing. Kai kazhuvama saapradhukku okkaradingo, toilet pona kai kazhuvama varadingo. Inspect your feet every day for wounds and sores. Kaal eppodum check panna, especially diabetics, you have to check every day. Walk at least 30 minutes per day. If you say, I can't walk 30 minutes, fine, walk 10 minutes. 10 minutes is better than not walking. Okay? So, இன்னைக்கு என்ன போச்சு, ஐயோ நான் போலான்னு இருந்தேன், இந்த சீரியல் பார்த்துட்டு இருந்தேன், லேட் ஆயிடுது, பரவாயில்ல, 10 நிமிஷம் போயிட்டு வாங்க. 1% is better than not doing it. Sleep 7 to 8 hours. That's what is recommended. Okay, try your best. Take care of your teeth, brush twice, clean your tongue, and see the dentist every 6 months. Never walk barefoot. வெளியில போகும்போது தயவு செஞ்சு, especially if you are a diabetic, do not walk barefoot. Have a comfortable shoe which you wear. Now you have these slip-on shoes where you don't even need to bend down and put it, you stand and put it on and go. So please do something. Eat protein at every meal, dal, paneer, curds or nuts. Get 15 minutes of morning sunlight. Get your flu vaccine every year and pneumonia and shingles vaccine whenever you are, if you are above 50. And before any travel, see your doctor 4 to 6 weeks before to make sure your checkup and medicines and vaccines are in order. Lastly, I think that's this last slide. Yeah. Lastly, one thing which, because I see a lot of patients right from 15 to 95, one of the things I notice is as you grow older, you start becoming lonelier. You've all had busy lives. You're doing purposeful work when you're young. Once you retire and then you start sort of getting older, you feel lonely, you feel neglected, you feel alone, and you feel depressed. Okay? There is a Japanese term called ikigai. Have you heard the term ikigai? Ikigai is also called as the reason for being. அதாவது எதுக்கு நம்ம இருக்கோம்? What is the raison d'être, they say in French? What is the reason we are there? All of us need to have a purpose in life. When you don't have a purpose in life, your mind gives up and your body gives up. So all of you have to find that purpose in life, that meaning in life. Why? Because common thing is, this is a very common. Everybody, they come to me and as though I'm giving them injections to get rid of them. So I tell them, unless you have a ticket, you can't leave. And forget waiting list or what is that other thing called? RAC. You don't even have a ticket. How can I send you off? And ticket, you can't get it. It has to come from there. Okay. So please remember, as long as you're living, whether it is 80, 85, 90, 95, you find a meaning in life. You find a purpose to keep you going. Every morning you should get up looking forward for that day. Okay, you're lucky to be alive. So please don't waste your time worrying about things which are not in your control. Because you make yourself miserable, you make everybody around you miserable. So that is the reason. Stay healthy, find your purpose, and stay healthy. Thank you.
It is lower.
Ideally lower, but when you grow older, we err on the side of keeping it a little higher because low glucose can kill. Somebody gets to 50, it can cause irreversible brain damage. So I'd rather you keep it at 200 rather than try to get it at 50. Ideally, normal is about 5.5 to 6. So if you can get to that level, excellent. But definitely not 8 and 10.
Yeah, thank you. Anyone else? Yes, sir.
Thank you, doctor. What is the sign of depression?
Very, very pertinent question. Several signs of depression are there. One, people come saying that they feel very low. That's very easy to diagnose. எனக்கு ரொம்ப கஷ்டமா இருக்கு, துக்கமா வருது, அழுக வந்துருது. நான் இதெல்லாம் இந்த மாதிரி இருந்ததே இல்லை. இப்போ எனக்கு ஏதாவது சொல்றாரு உடனே நான் அழுதுறேன். Okay, so one, a feeling of depression, that you insecurity,
worthlessness, feel low, worthlessness.
Worthlessness is a very correct word, and stania, a lack of interest in anything. So what you used to enjoy before, I used to love going to movies. For movies shopping. You lose interest in things which normally you would be interested in, and your partner will tell you you have mood swings. நான் ஏதோ காம்லெஸ்ஸா ஏதோ சொன்னேன், பயங்கரமா கோவம் வந்து கத்த ஆரம்பிச்சிட்டார். These are also, so the partner will realize it before you feel these symptoms. That's the first thing. And this lack of interest will mean you become very lethargic. வெளியிலே போக வேண்டாம், நான் வீட்டில் இருக்கேன், நான் தூங்கிட்டே இருக்கேன், Some people start gaining weight because all they do is eat and then sleep because they lose interest in everything. So there are several signs which you can look at, but what I told you are some major ones. So please remember there are excellent medicines now for depression. People think that psychiatrists they'll give you something to make you sleep, you'll become like a zombie. No. Basically, depression is because of good chemicals going down in your brain and bad chemicals going up. That's a very simple way to put it. So what the medicine does is we have what is called a selective serotonin reuptake inhibitors, SSRI now. So these medicines push up the good chemicals and pull down the bad chemicals. So whatever the reason for the depression is, it could be reactive depression, the death of a spouse, a change in scene, it could be loss of somebody, your friend, or it could be endogenous. Sometimes there is no reason, you just feel depressed. So in these situations, these medicines work wonders. I've had several patients who come and tell me after 1 month, I'm feeling so much better. Yes, ma'am.
I'm not diabetic, I'm not blood pressure, but I have pulmonary HTN.
Pulmonary
HTN.
hypertension. HTN is
So
hypertension.
should I take Shelters especially?
Absolutely. You definitely look above 50. So no questions.
I'm 82.
Excellent. You have to take above 50. These are all safe vaccines, effective vaccines, available vaccines. So to me, it's a no-brainer. In the vaccine work panno, it is safe, in a healthy vechikom, pay panna mudiyum. In a shingles vaccine, it's expensive. But if you can afford it, take it.
4 or 5 injections, you have to take it.
கண்டிப்பா எல்லாம் ஒரு டோஸ் தான் மேம். சோ நிமோனியா நீ போட்டதுக்கு அப்புறம் நான் போட்டுக்க வேண்டாம். டெட்டனஸ் நான் இப்போ ஒன்று போட்டா 10 வருஷத்துக்கு போட்டுக்க வேண்டாம். சோ ஒரே நாள் போட்டுக்க வேண்டாம். இன்னைக்கு நிமோனியா போட்டுக்கோங்க, நான் ஒரு வாரம் கழிச்சு ஃப்ளூ போட்டுக்கோங்க, ஒரு வாரம் கழிச்சு ஷிங்கிள்ஸ் போட்டுக்கோங்க, ஒரு வாரம் கழிச்சு டெட்டனஸ் போட்டுக்கோங்க. அவ்வளவுதான்.
Different types of vaccine, doctor will not give us.
Yes. தாராளமா கொடுப்போம். These are things which make a difference. See, there is something called optimism bias. Optimism bias is, it's referred to as a cognitive bias where when we are healthy, we think we are invincible. So if a flu எடுத்துக்கோனா எனக்கு எதுக்கு flu, நான் நல்லா இருக்கேன், 1 hour நடக்கிற ஒரு நாளைக்கு நான் எனக்கு ஜலதோஷம் வரதே கிடையாது, நான் இருக்கு. But if you get it, but so don't look at depending insurance எடுக்கோனா எனக்கு எதுக்கு இன்சூரன்ஸ், எனக்கு 50 வயசான ஆகுது, எனக்கு எதுக்கு லைஃப் இன்சூரன்ஸ். No, just because நெருப்புனா வாய் வந்துடாது. At the same time you have to be proactive and think sensibly. இன்னைக்கு இல்லனாலும் 2 வருஷம் கழிச்சு வந்தா how do I stay healthy, அப்படிதான் யோசிக்கணும்.
Excuse me, I did a course on diabetes, controlling diabetes, and after that, the doctor said that I don't have to take my blood pressure medicines because BP also came down. And even today, I don't take BP medicine. Recently, I went to a doctor for regular checkup. He said you cannot stop BP medicines once you started it. But I am off medicines now.
Good question. In general, high blood pressure, high sugar, high cholesterol, thyroid, these are all conditions where once you start on medicines, in general, it is lifelong. Okay? But if you modify your lifestyle, for example, I am 90 kilos, I lose 20 kilos and become 70. I may stop taking my diabetes and have blood pressure medicines. In other words, control comes just because by weight reduction. That's why they do bariatric surgery. Because some people, whatever they do, you cannot control their sugar. You do bariatric surgery and they lose 50 kilos, everything comes under control. So, in general, it is lifelong, but there are situations where we can come off it. So, as long as you monitor every 2-3 months, check panikongo, normal arda, that's fine, you're lucky. Yeah, excellent.
Very often we hear about exchange cases of
I think a very, very difficult topic. The cholesterol, the normal cholesterol, the normal BP, the normal sugar, it keeps changing, based on new findings. In fact, one of the famous Aldous Huxley's statements goes that, medicine has made such a remarkable progress that we don't even have one healthy human being around now. So what was considered normal 10 years ago, now they say cholesterol up normal 130 irundhu, ipo 100 dhaan, so you need to take medicines. 100 irukku enak ipona illa ipo now the latest guidelines say it should be less than 70. Even one of the theories is pharma companies want to sell more medicines, so they keep coming up with evidence stating that kora and the mari. We don't know, science keeps evolving, but yes, I agree with you. நேத்திக்கு சொன்னது வந்து இன்னைக்கு அது தப்பும்பா, இன்னைக்கு சொன்னது நாளைக்கு தப்பும்பா. We can only go by what we know today. But that happens, and all of us also wonder about it.
Diabetic. I keep walking 15,000 steps a day.
Excellent.
So, but many of my friends told me that too much of walking will cause knee joint problems. So, what is the ideal number of steps per day?
See, again, it was the Japanese who said that 10,000 steps a day is what you should aim to do. But newer, and this 10,000 எப்படி வந்தது? ஒரு தோராயமா வந்தது. Okay, now people feel that you don't need to walk 10,000. 5,000 to 6,000 is good enough. Okay, what I would like to tell is, if you are walking 15,000 and you are happy doing it and enjoying it, do it. There's nothing wrong with that. Knee joint வெறும் நடக்கிறதுனால you won't get knee disease. High impact, concrete roadல தக்கு daily ஒரு 15 ஓடுனா marathoners, people who strain that is high impact on a regular basis for long periods of time, avadukku knee and hip will wear out. If you are walking with good shoes, 15,000 steps in open this thing, no issues. Enjoy.
I was told,
Sorry sir.
I was told that the flu virus mutates quite often.
Flu virus
Mutates
mutates quite often. Yes.
quite often.
Yes.
In USA, the last year flu vaccine is not useful for this year.
Correct.
What about the condition in India?
Same thing. See, this flu virus is an RNA virus, which, like COVID virus, keeps changing very, very often. Okay? The change in the virus genetic structure is called mutation. So, the genes and so on, the genes வந்து மாறிக்கிட்டே இருக்கும் every year. So, இந்த வருஷம் வந்து H1N1 ஒரு டைப்பா இருந்தா next year இருக்கிற H1N1 it will be slightly different. So, flu viruses இன்னும் கொஞ்சம் depth up போனோம்னா there is called a two types of variation, genetic drift and genetic shift. Genetic shift is a major change. H1N1 and H1N3 are. Genetic drift is minor changes happening in the genes. But whatever it is, as you said, in the வருஷம் அந்த flu virus next year வரதுக்கும் difference இருக்கும். நான் இந்த வருஷம் போட்ட flu vaccine செல்லாது next year. So இதுக்கு என்ன பண்ணணும்? The World Health Organization has various surveillance centers in all parts of the world which collect data about flu virus. So இந்தியால இருக்கு, ஆஸ்திரேலியால இருக்கு, அமெரிக்கால இருக்கு, ஜப்பான்ல இருக்கு, எல்லாம் வந்து northern hemisphere-லயும் இருக்கு, southern hemisphere-லயும் இருக்கு. Every year the data from these flu virus surveillance, where they analyze what kind of virus is there, is sent to the World Health Organization, and the World Health Organization predicts, இப்போ மார்ச்ல வந்து they will predict what should be the what will be the likely strain which is coming in August, September or winter this year. Based on this information, they manufacture the flu vaccine. So there are two vaccines. There is a northern hemisphere vaccine and a southern hemisphere vaccine. Australia June la winter varum. So Australia June la flu spike up. America Europe winter in December January, flu will go up in December January. So there is a northern hemisphere vaccine which is usually predicted in March and comes out in July, August. There is a southern hemisphere vaccine which is usually predicted in September or so and comes out by March next year. So this keeps changing. So whether it is US or India or Australia, that time circulating strain depending on northern and southern hemisphere is what you take. So what you get in USA now in July will be the same as what you will get in India in July. The next question, when do you take the flu vaccine? So flu vaccine, usually the flu season is before the winter or in areas there is no winter. India, Chennai winter, Coimbatore winter. Usually before the monsoon season. So Chennai, I would advise a flu vaccine in August, September before the monsoon hits in November. Coimbatore, the monsoon will hit by June, July. You take it now. So if you vaccine, you don't need to wait till September, October. Chennai, I give it in August, September. Whereas Bombay, Kerala, they should take it in March and April. So March and April of southern hemisphere vaccine is available, that is given. In Chennai by September, October, the northern hemisphere vaccine comes in, I will give that. Confused panitana,
Doctor, you said 7 to 8 hours of sleep, but I doubt any of us must be getting that. So
no, getting that means you are
You don't get your sleep or you can't sleep?
You can't sleep.
Okay.
So I doubt any of us must be sleeping about 8 hours. But can we take some pill or magnesium to get the 8 hours?
Shouldn't be a problem.
If, for example, my father sleeps 5 hours and for him 5 hours is fine. He works perfectly fine in 5 hours time. Okay? And he tells me, since college days I've slept 5 hours and I'm feeling fine. Don't push yourself to lie in bed for 8 hours and waste time. If you're feeling fine, energetic, clean, clear, 5 hours is fine. There are people, for example, I need 8 hours of sleep. Now, if now 3 நாள் 7 மணி நேரம் தூங்கினா 4வது நாள் எனக்கு மத்தியானம் ஒரு half an hour தூங்கணும் முடியாது. So I will do this. So you decide what suits you. You don't need to force yourself. If you're fine, don't take medicines. But if you say you're not fine, before you take medicines, I told you several things you need to look out.
Yes.
Night 10 மணிக்கு படுத்து காத்தால 5 மணிக்கு எழுந்துக்கிற மாதிரி வெச்சுக்கணும். Make sure that you turn your phone off. Don't watch TV late. The blue light இருக்க கூடாது. TV screen, phone screen, movie ஒண்ணுமே பண்ண கூடாது. Don't take coffee, tea later in the evening. Don't exercise too late. Don't have a heavy meal. Correct all this. தூக்கம் வருதோ இல்லையோ, you should be in bed at 10, whatever time you go to bed. Okay, so get your discipline organized first, which is very difficult. Nobody does it. And then you can take your magnesium, your melatonin to start with. அதுக்கப்புறம் zolpidem. And once you start taking these sleeping pills, these are addictive. Whatever they may say, the least addiction which is zolpidem. I know people, கொஞ்ச நாள் கழிச்சு டாக்டர் prescription கொடுக்கும். So you have to accept that.
And frequent loss of memory be ignored. Frequent loss of memory can it be ignored?
Loss of memory can be ignored. All of us, as we grow older, like our immune system goes down, our brain cells start atrophying. The brain starts shrinking. So all of us will lose memory as we grow older, typically after the age of 55 or so. You will be anyway, who is the youngest one here? See that person. So the first thing, you're very young. So the first thing you start forgetting is names. Okay? You know the person, அதே மாதிரி city, place, அந்த மாதிரி. And as it grows, then நான் எதுக்கோ வந்தேன் வெளியில ஏதோ பண்றதுக்கு என்னதுக்கு வந்தேன்னு மறந்து போச்சு. Okay? So in fact, I started this about 4-5 years ago. I asked my neurologist friend, I'm beginning to forget things. Am I getting Alzheimer's disease? Am I getting dementia? So he asked me one thing. சரி மறந்து போற, பட் அது திருப்பி ஞாபகம் வருதா? Then you say, whether it is half an hour, 1 hour, 6 hours, 8 hours, you get it back. That is normal. That is not dementia. Suppose வந்ததுக்கு அப்புறம் அவன் பேர் எனக்கு மறவே இல்லை அப்படின்னா, then that needs to be checked back. So there is a very simple way to decide, because this happens to everybody, and I notice this. People who are 45 or 50 are having this. My students, they come and say, "Manu pochikana." This is inevitable. We are bombarded with information now. So our brain doesn't focus. There was a time when I could reel out 50 telephone numbers casually. Now, your number cover maybe my wife's number I know, but I don't know any cell number because it's all there. Why do I need to memorize it?
Care and prevention of hantavirus.
Hantavirus. Okay? Hantavirus is a virus which is uncommonly seen. So first of all, this is not a very common virus. There are 2 types of viral strains. Okay, one which is often seen in Asia and Europe, what is called the Old World, and one that is seen in America, North and South America, which is called the New World. 2 types of viruses, and they both produce different kinds of infection. The Old World, what you see in China, India, the hantavirus causes hantavirus hemorrhagic fever. அதாவது டெங்கி மாதிரி ஜுரம் வரும், உடம்பு வரும், sometimes bleeding வரலாம். Whereas the New World virus is a pneumonia virus which causes breathing difficulty. Very typically, this is acquired from rodents. Rodents na enna? Eli, porcupine, squirrels, beavers, and the மாதிரி animals ஓட motionலயோ, எச்சல்லையோ, இல்லட்டா urine ல இருந்தோ வருது. Sometimes the animals may be normal. So if you are cleaning places where there are rats, mice, theoretically you can get it. But let me tell you, in general, house rats here don't carry the virus. So chill. Very problem கிடையாது. It's mainly deer mice, especially North America. The deer mice, the deer rat is the one which transmits. Okay, so theoretically, it is from rodents, and you can get it easily from rodents. ஆனா ஒரு மனுஷன் கிட்ட இருந்து இன்னொரு மனுஷனுக்கு ஜெனரலா பரவவே பரவாது. எஸ்பெஷலி ஏசியா, யூரோப்ல பரவாது. அமெரிக்கன் ஸ்ட்ரெயின்ல வந்து ஆண்டிஸ் ஸ்ட்ரெயின் ஒன்று இருக்கு. அது கேன் ஸ்ப்ரெட், பட் தட் டு க்ளோஸ் கான்டாக்ட் இருந்தா பரவறதுக்கு சான்சஸ் இருக்கே ஒழிய ரொட்டீனா பரவுறது வெரி அன்காமன். எஸ், பட் இப்ப வந்திருக்கிற இந்த ஷிப்ல இருந்து வரலது. ஒன் ஆஃப் தி டூரிஸ்ட் இன் Argentina, he picked it up during a trekking expedition, came on board, and then he transmitted it. It's very uncommon. I wouldn't lose sleep over it. I wouldn't worry about it.
Doctor, there is a lot of talk about this intermittent fasting. It helps your diabetes and all other comorbidities, and it is true.
If you like it, do it. It is not majorly harmful. It doesn't, again, it's disciplined eating. Only thing is you eat during specific period.
Okay.
If you like it and if it helps you and you're able to do it, there is no major downside to it. I can't do it, I don't do it. But it's okay.
But what is the preferred timing, like 12 hours or?
The longer the break, the better. Indian என்ன பண்ணுவாங்க நம்ம ஊர்ல சாயங்காலம் 5 மணிக்கு before sunset they eat. After sunrise only they will start taking, which gave clear about 12 hours also. Evening 5:36, now morning 6:30 can சாப்பிடுவோம். So 12 hours, some people push it to 16 hours.
Yeah.
I think you have to learn moderation in life. We are not machines, we are not trying perfection here. As long as you don't binge and then go and starve, have a moderate life.
Thank you.
I think you have a flight to catch too. But thank you very much. And before. Oh, no, I'm just saying from here. Dr. Balasubramanian, it's been a it's been a great evening with you, and the fact that you have been so, the way you actually shared your thoughts with us was so colloquial and not doctorate driven. So thank you very much. Can we all give him an applause before a final conference?
Good, sir. Good. Very good.
So your final
Yeah.
words.
On behalf of our residents, on behalf of myself, my wife, we all thank Dr. Ramasubramaniam and his family for coming and honoring us. Thank you.